Hello and welcome to this week's Take 5. So I've been having some low back tenderness this week, so I thought we would do our Take 5 for the low back today. So go ahead and come down onto the mat. And we're going to roll ourselves all the way down onto the mat. Taking a moment to take a nice deep breath. Very often when we have back pain, it inhibits our breath. So taking a moment to find that deep breath, and as you exhale, allowing your pelvis, the back of the ribs, and the shoulders and the back of the head all to be very heavy into the mat. We're not pushing anything into the mat, we're just letting the exhale allow us to kind of sink and melt into the mat. So let's take another deep breath. And exhale. So our first movement today is going to be pelvic tilts. I want you to think of your pelvis like a compass. Your belly button is north, your pubic bone is south. And we're going to gently rock our pelvis from north to south. Try to do these slow rocking movements without using any muscles. So just try to think of it as the bones of the pelvis rolling back and forward. So our Take 5, we do 5 mindful reps. Exhale, I like to exhale as I tilt to the north. Inhale as I tilt to the south. Let's do one more. North and south. Good. Movement number 2. Arms come open into a low V with the palms facing the sky. You can keep your feet where they are, or you can take them out to the width of the mat. Go easy with this if you're having low back pain. Nice deep inhale. You're going to roll your pelvis to the east. So now we're going east and west. So rolling the pelvis to the east, keeping both shoulders heavy on the mat. Exhale, heavy roll back to center. Inhale, roll the pelvis to the west and back to center. The objective is not to get the knees towards the floor. The objective here is to get some movement, rolling the pelvis side to side, letting the hip sockets be nice and relaxed, and follow along with that movement. So this is not the knees leading the movement, this is the pelvis rolling from east to west. Nice and heavy. Good, let's do one more each side. This may be 6 repetitions since we have to go side to side and make it even. And other side. Good, and back to center. Bringing your heels back in line with your sitting bones for movement number 3. Arms down along your sides. As you exhale, you're going to tilt your pubic bone up towards the sky. Stand into your feet and peel your spine off of the mat just to bra strap level or just below. So this is just a baby bridge here. And then curl your spine back down onto the mat, nice and slow. Exhale, pubic bone up towards the sky, stand into the feet. Try to release your glutes here as you peel the spine just halfway up. And exhale, roll down nice and easy. So this is like a little bit of a low back massage. Making it nice and smooth. Exhale. allowing the weight to come into the back of the body. Let's do one more. Tilting up, standing into the feet, releasing the glutes, and rolling down. Movement number 4, lengthening your left leg away, bringing your right knee into your chest, giving it a hug. You can go ahead and flex and point your foot here if that feels good. Now, if your low back is feeling okay for it, you can take your right arm out to the side and then exhale into a little bit of a spinal twist. Again, we're not trying to go very far. Shoulder stays on the mat. You're just rolling your pelvis over to that side and back to center. Good. Right foot comes to the floor. Left knee comes into the chest. Right leg extends away. Good. If you are feeling up for it, you can flex and point the foot. If your low back feels happy to do it, you can come into that spinal twist, keeping the shoulder heavy on the mat. Gentle spinal twist. Again, we're not trying to force anything. The fascia responds to the gentlest of touch and the gentlest of movement. And roll back. Good. Movement number 5. Bringing both knees into the chest, giving them a hug. We're going to make circles with the knees, imagining our thigh bones are stirring within the hip socket. So imagine you're stirring those thigh bones in the sockets. I think that was 5. Let's reverse. For 5, trying to let it be nice, fluid. Imagine your hip socket is coated with olive oil. And 2. And 1. Give those knees a hug, taking the feet to the mat, rolling to your side to come up. And there it is, your take 5 for low back pain today. Remember, 5 mindful repetitions using your breath. So important when you're dealing with any kind of low back pain. 5 days in a row, and I hope your low back feels better for it. I know mine does. And I'll see you next time. Bye-bye.